The thyroid gland is present in the front of our neck. It has two lobes connected to each other. It produces a hormone called the thyroxine. And thyroxine is a hormone which we require for our metabolism. The food that you take in, it may be used metabolically more or less depending on the thyroxine. So it's an important hormone in the body. Most of the time, we find that people do come with thyroid nodules. There's again another thing that it concerns many patients, that there may be, something problem in my thyroid. There's a nodule there. So thyroid nodules per se, most of the time are benign. Most of the time, very clearly are. They are commonly present in women. If I take a group of women of the age 50 and do an ultrasound for all of them, more than 50% will have thyroid nodules. They may have one or multiple. So when should we start evaluating these nodules? So thyroid nodules need to evaluate usually when they are more than a centimeter. So an ultrasound, anything above a centimeter, we start evaluating them with a series of tests. How can a nodule be present? A nodule can be present in a person, like in a woman, without any particular cause. There may be nodules. There may be benign nodules. The nodules can be present in people who are hypothyroidism, that is low level of thyroxine. So the gland is increased in size, there can be nodules. It can be present in people who are hyperthyroids, that higher hormone level. So again, a nodule is formed which is autonomically producing more amount of hormones. It can also be present in people who are having thyroid cancers. Most of the time, they are benign conditions, especially in a woman. In males, whenever the thyroid nodules, we are a little suspicious because males usually do not have thyroid nodules. So, like I said, you have a thyroid nodule and they could measure a centimeter. You go to a doctor. Doctor usually tells you about 3 particular tests. The first one is thyroid hormone status. T3, T4, TSH that you perform routinely when you're doing blood tests. It is just to see whether you're hypothyroid or hyperthyroid. Next that we do is an ultrasound. The ultrasound nowadays tells you what is the size of the nodule, what is the type of nodule, hard, cystic, calcification, various things with that. And usually you'll find the ultrasonologist write something called TIRADS. TIRADS, it's a classification. TIRADS 1, 2, 3, 4, 5, depending on what he finds in there. The more the thyroid's number is, he's suspecting that it may be not a normal nodule. So the lower the thyroids, that's most probably. But if it's a higher thyroids, then what do you do next? You are asked for an ultrasound guided needle test, an FNAC, fine needle aspiration cytology. So they put a small needle and just take out a little bit of cells and test it. On testing again, there's another classification called the blood tester, by which again it's 1, 2, 3, 4, 5 and 6. 1 and 2 are generally normal, 1 is inadequate, 2 is benign, 5 and 6 are almost cancer, 3 and 4 are indeterminate. So it gives you an idea or tells you what it is. So most of the time when we have a thyroid nodule in a woman, we test them. Usually we'll find it as a Bethesda 2, a benign nodule. Very rarely do we find it in the others.